Yes, guys, we're here in the Negros Polymedics. We are waiting for the doctors, cardio, and the family doctor, Walter. Yeah. My husband will check for the follow-up, and we just get the result to the echo result. Check out for the cardio. This is the doctor. She had it. This is the Negros Polymedic. This is a big area. They have an X-ray. So they have a elevator, emergency room. So this building office. It's a nice new hospital here. So the security guard is here. The receptionist this side. Pharmacy. Okay, sure, whatever. Yeah. This here, the patient. This is the director. This is the directory of the doctors. If you need it, pediatrics, dental. They have a dental here, so probably I can have it here. Surgery. So this is all the directory here. Okay, we just have our snack here in the canteen, cafeteria. Here the restaurant here in the Polymedic.
Yeah, to come in and buy a mask.
So
Because people are just used to that.
yeah,
They're gonna do it.
then sometimes they forget. Hospital is very strict note. Also the plane. So yep. Protocol is still protocol. The mask here in the hospital. All the hospital will be also protocol to wear a mask. Even the airline. But malls and ever crowd area you can no longer. But comes to the hospital, totally it's a protocol. My husband was doesn't like it. What we gonna do? It's a protocol to wear it. And I just got my banana maroya. We call that maroya. My snacks and 7-Up. Oh, Sprite, I mean. Sorry. Sprite and water for Walter.
See, that's the problem.
Yeah, we're gonna wait for the doctor. Doctor
People
gonna
go down there and they walk in and she lets them sit down.
Huh?
She did it with us too. The problem is they walk down there and they say something to her and then she lets them sit down. If they can sit down there, and then he sees them next. She don't go, the whole time we were sitting there, she didn't come out till the whole time. So how do those people get in the office? The woman did. Then she came back and called them out.
Mm-hmm.
So,
What doctor?
Cruz,
Cruz?
they were in there.
Elsa was already calling?
When I stuck my, she never went down there and called anyone. They were sitting in there. And so the little woman got up, because the young woman came and stood next to me, and she was telling her, go down and see what's taking so long. So she went down, and then she comes back and she tells him, come up. So with us, he loses big time because he gets 1,000 for us. If I go in there, wait another 30 minutes or so, we're going to tell him, no, just have him, you call us, but he can really see us. But you can't come out here and spend a half a day waiting, and he's not going to see us. And then she's going to look and see you, and he's going to look and see you. It's 1,000. This one just walked out the door.
So we need to be patient, and that's the way it is.
Because they just let more people in there.
Yeah, we cannot sit there because already a bunch of people there. Maybe we don't know. Maybe they are there early. We don't know. They are there early, then they just go back. We don't know. Only the secretary know if that
We were there
early
early,
bird
we were
or
there.
huh?
We were there early, and then we came.
We are just came at 2 o'clock. Then maybe they're in 12, 11 or
No, because he doesn't
yeah.
even come in till 2.
Huh?
He doesn't even come in till 2.
Who?
Him. He's at the hospital till 2.
No, but the secretary is already there early in the morning, around 8 o'clock. So we don't know, the patient is already there and talk already the secretary. Gawi, kaya punti sila. Oh my God. Okay. I'm still waiting for doctor. Thanks.
Okay, so your 2D echo is already here.
Echo, you got the echo, you got the blood tests, you got everything.
And we give early the laboratory result.
Do you have a duplicate copy of this?
Yes,
you have-
yes,
you
sir.
have
But
duplicate.
That's your copy.
Okay, that's good.
but the for the echo is
It's usually 2 copies.
yeah,
So
it's
you
for
have your
you.
own.
We already gave her a copy.
Yeah,
Okay.
we give already to the doctor
Yeah.
Dinor or the secretary. The secretary.
If you will be seen by Dr. Dinura today,
Mm-hmm.
our EF or the ejection fraction. The ejection fraction simply means how much percentage does your heart beat or does your heart pump out blood
Right.
to supply it all over our body.
Yeah.
So we have a normal value that we are following, which is 55 to 77%. That's the normal ejection fraction. Your result is, I highlighted it at 42, meaning it's below the normal. What is the problem is that you are having a heart failure with a low ejection fraction. Because there's this heart failure with preserved ejection fraction or the normal ejection fraction, or high ejection fraction. Your category is heart failure with a decreased ejection fraction, meaning the heart sometimes, not all the time, there are times that it will delay in pumping out blood, and then it's not the normal love dub, love dub, love dub. That's the normal beating of the heart or the pumping of the heart. With this result, it's usually like this: love,
Take.
dub, love dub, love dub, love dub. So the pumping of the blood is really not normal, because the percentage that it pumps out blood is decreased. So there's a heart failure that is happening with the heart itself. But you have all the medications, I guess. But also I will leave the maintenance if Dr. Adinura will change it, or if she will give you another prescription, so that it will not be double. Because I can give you medication for this, but since you have an appointment and you will be seen by her,
That's the way I'd rather do it anyway, because
yeah.
some of those that I'm taking are blood thinners.
Yes. Yeah.
I've got to quit taking those because I'm having cardiac, or having cardiac, my, what do you call it?
Don't do this. Your eyes?
Yeah,
For your eyes?
Ophthalmologist for the eyes.
it's through cataracts.
Yeah.
I'm having cataracts removed, so I got to quit taking the blood thinners for 5 days before.
Before the procedure.
Right.
Yeah.
But as you can see, I could just touch something and I'm going to bruise.
Yeah.
I could, and bleed. And once it starts bleeding, it's hard to stop.
Yeah.
And I read one of the boxes, on the box of one of those, it says, take after you down a stent for no more than 6 months. That's 2 years I've been taking.
The aspirin.
Aspirin I've been taking, that was a mess up for the first cardiologist because he prescribed the strong dose, 230 something, and I was taking that for years. Until finally one of my friends who's doing the same thing, he said, how do you take such big aspirin? Because I only take a baby aspirin. So I went back to the cardiologist. I asked him.
How many milligrams of aspirin are you taking again?
Right now, I think it's 18.
80. It's 80.
81, yeah. 81, the baby
80
aspirin.
to 80 milligrams. That's the lowest effective dose actually.
Right. But then I'm also taking something that said, like I said, it says it's a blood thinner.
Yeah.
And do
So
not
we have
take it. I think that's only 2. That's why I'm going to see her
Yeah.
and say, how many blood thinners am I taking? Because I think the triazidone, I forgot what the pronunciation of it is, but 2 of these I know are blood thinners. The aspirin, and then the other one is a blood thinner, and you're not supposed to take it for more than 6 months. I've been taking it for 2 years.
So you're still taking it?
Yeah.
That's a listing of your medicine there.
Yeah, I want to give it this to them, but this is what I'm taking. And the one on the bottom is also a blood thinner.
The clopidogrel.
So those are the 2 blood thinners. Only 2.
Aspirin number 1 and the last one.
Yeah. And
Yeah.
this one says don't take more than 6 months.
Actually, sir, you can sit down now. Actually, there's more risk of bleeding with the aspirin than the clopidogrel. It's more, you have more bleeding tendencies with aspirin than clopidogrel. Clopidogrel is much more safer than aspirin. So, but anyway, if Dr. Dinura will know your concern, especially if she sees this, she will possibly stop one of those.
That's what I'm thinking. Personally, I would stop all
But
of them.
if I am to manage that, I would stop the aspirin first and putting it with the clopidogrel because it's much more safe. Anyway, either of the two, you still need to have a blood thinner due to the problem with the heart. So as to avoid any clogging or any
Oh.
any with the vein and arteries going to the heart. So the blood should be thinner than the usual.
Yeah.
Okay, so much so, again, the ejection fraction is low, and I highlighted three words. It says here, left ventricular hypertrophy, meaning we have two parts of actually four parts. We have the left and the right part of the heart. The left ventricle, or the left part of your heart, becomes larger than the other side. Why? Because the heart is compensating to pump out blood. Our heart is a muscle. So if you work out, most of the time, any of your muscle, it will become big.
Yeah.
So there's a bit of heart enlargement on the left side of the heart, compromising the blood flow. And then the pumping out of the blood is compromised also. But you have, again, your medications that will help your heart compensate with the problem. Okay? So that's the result of the 2D echo. Your blood type, Sir Walter, is O positive, O plus, it says here. Did they give you a card for the blood type?
No.
Yeah.
Maybe you can ask them later before you go home, because they have a card wherein you will your information is indicated, your blood type is indicated, and there's a portion that you will put, or you will place your 1 by 1 picture and have it laminated. Put it on your wallet anytime you have an emergency with your blood type.
Okay.
Okay?
So we can ask here.
Yes, po. Ask lang po, ma'am, can we have a card or ID for the blood type? Okay, your hemoglobin count, sir, your complete blood count, okay? Your hemoglobin is 13.8, this is normal, you're not anemic. Your white blood cell is also normal, you don't have any infection. Hematocrit is also normal. Platelet count is 231, meaning you have no suspected internal bleeding. I think that those are the effects of the blood fever level. But your platelet count is 231. Normal platelet count is 150 to 400. If it drops down or below 150, meaning you have an internal bleeding happening inside your body. But it's normal. So your CBC is normal.
Oh, good.
Your urinalysis. Your urinalysis shows a good result. You don't have any infection like urinary tract infection or UTI. There's no protein in the urine, meaning your kidney is possibly working good. So your urine test is normal.
Because yeah, I always drinking medicine.
Yeah.
Taking your medicine.
That's the
damages usually.
that's the solution to any medical problem. And of course, eating the right food and having the daily exercise would also help. Okay, we tested your glycosylated hemoglobin, or HbA1c. This is a test for diabetes. Your result is 5.9. By the way, the glycosylated hemoglobin, or HbA1c, will tell and will gauge the sugar in your body for the past few months. So if this was done last May, right? So it includes March, April, May, going backwards. The past 3 months of your sugar in your body. So starting March, April, and May, your result is 5.9. It's normal.
I don't need sugar.
Yeah, that's good. Okay, chemistry. Creatinine, this will test your kidney function, also your uric acid. It's normal. Both are normal. Uric acid and creatinine are both normal. Sodium, sodium and potassium are electrolytes in our body. They are the water that will give us strength. If you are dehydrated, your sodium will go down, your potassium will go down. Your sodium is a bit low, it's 130. Our normal value should be 125. But it's insignificant. The value is insignificant. If it went down to 110, then I will give you a supplement for the sodium. Just take enough water, 12 glasses of water a day. That will suffice the a bit decrease in your sodium. But however, your potassium level, Sir Walter, is normal. Okay? SGPT. SGPT is test or gauge for our liver function. It will test your liver if you're having a problem. It will automatically will go up. The value will go up. But your result is 28, it's normal. The normal value is 21 to 72. So 28 is normal. So with the results, I don't see any problem with your kidney and your liver. Okay, we'll see the cholesterol level. Total cholesterol, triglyceride, and also the bad cholesterol are all normal. So, doing good?
Yeah, I can
Thanks,
pretty
good.
much read these tests. I've had it done so many times.
Yeah.
Hers are the ones I'm worried about.
Bad.
Hers are bad.
Yeah, we'll go to her result after yours. Okay. Your chest X-ray.
Oh my gosh.
Your chest X-ray shows your lungs are normal. There's no phlegm. There's no suspected problem with your lungs. Surprisingly, it measures also the chest X-ray will also look at the size of the heart in totality. So it doesn't just examine your lungs if you have pneumonia, if you have bronchitis. It also sees the size of the heart. With your X-ray, it says here that your heart in totality is not enlarged. It's also the other portion only. Okay? But there are arthritis seen when it's part of.
Yeah, I've had that for years.
And then the sternotomy wires are also seen with your previous procedure. So the wires are still in place. So that's it. Basically, Sir Walter, your results are very good.
Wow.
I will leave the maintenance for the heart to Dr. Linora. You still feel dizzy?
Wala na.
Wala
Oh,
na.
pero this morning, naging masay, malimot ko dok mo.
Mukalit ba?
Kalit lang kong tindo.
Sudden change in position. But it resolves on its own.
Yeah.
Were you able to take the dizzy the ones I prescribed to you?
Wala sila available dok. So, wala ko katikad to na nga time. Kaya wala sila stocks na. Adto ko laing mga kuhan wala. Maski sa Mercury.
Different brand? Basta same generic name?
Wala ako nag-try. Kato lagi akong gipakita do. Wala ko nag-try. Tag generic.
They wanted to charge more for her alprazolam than they did for my.
Yeah, dok.
Are
About
you taking alprazolam also?
no,
not
no.
alprazolam, whatever she takes. They wanted to charge. It was like 10,000 pesos.
No. Ang ibig sabihin daw, my medicine is more than the price of lesser the alprazolam that
It's more than alprazolam.
mine is
And that used to be free. In the States, it's free.
yo
Not because of
Which
that.
one, the lisinopril?
yo dok
Publix, grocery store would give it to you free.
free, that's free for us
That was a
dok.
grocery
Then I
store,
was
that policy.
wonder why here is more than that.
Yeah.
Then I want to change, by the way, the lower that
Lower price.
I'm looking for the generic, but they don't have it.
With the lisinopril?
Yeah.
The lisinopril, okay. We'll try to see if we can give you an
Less
alternative for the lisinopril.
Yeah.
But it should fit what you need as a patient.
Okay.
It's not being a doctor is not about the price.
Oh yeah,
It's about
correct.
what would benefit you and what fits you regarding your case.
Oh, okay.